I'm Dr. Sonia Doherty, naturopathic doctor. I'm here with my sister and fellow co-founder of Exceptional ND, Dr. Krista Doherty, ND, and of course, Dr. Jody Peacock is our third co-founder, and she's not with us today, but we know that she's doing good work, just as our guest is well known for doing in her clinical practice, Dr. Katrina Cox, naturopathic doctor. So excited to have you here today. I've had the privilege and opportunity to see you speak on a couple of occasions, and you're such a fantastic speaker. You have incredibly important messages. I know you do a tremendous amount for our profession, so thank you so much for taking the time to join us today. And yeah, just excited to hear a little bit more about what you're up to, and want you to definitely share your amazing book that I think every naturopathic doctor should have, so they can hand to any patient who's unfortunately going through the difficult process of dealing with cancer.
Thank you. I'm really excited to have a chat and spread my knowledge.
Wait, I'm going to show you. Oh, wait.
So
I was going to try to put the book up, but I forgot how to do it.
I can do that.
Yeah,
I can do that. But it's the opportunity in cancer. And you also have a website that helps people who are in this journey, Cancer Remission Mission. And I love what you said here, and I wrote down just because I didn't want to say it wrong, but where survivors become thrivers, right? Transform survival, become a thriver. And I love that. And I love that the first time I got to hear you speak when we were in Saskatchewan.
Yeah, the whole concept is that, and I know it's about cancer remission, but the states that you go through when you're being brought through cancer, we miss a lot of times the emotional components. We miss the components of being in that survivorship state, waiting for the next scan, those types of things. And how do we recover that trauma? Right? It's not just mental, it's also physical and physiological. And how do we recover that? And what are the steps to figure out where we actually are? Because it affects people differently in so many different ways. It is revolutionizing in the fact that it is a very specific type of disease process. And the way we treat it also has a lot of emotional components. I don't know if you noticed the wording that we use. It's the fighting, it's the war, it's the, like there's
battle.
A lot of that, the battle, right?
Yeah.
And not that that's a problem, but it strikes emotional chord when you talk about that, right? And one of the things that I struggle with is the fact that there is a crap ton of money being put out there for research, which is great. It's gotten us to this point, but that research isn't always about, and most of the time is not about, the people who are trying to recover, because the things that we use are very impactful physiologically, right? And a lot of my patients will say things, or people that find me will say things like, what do I do now, right? And their oncology team will say, just go home and do what you were doing before. And that to me is the definition of insanity, because part of what you were doing before is what brought you to this place, and you are not the same person. So to expect to go through that kind of intensity and come out and be the same as you were prior to the diagnosis, that is ludicrous. And it's setting somebody up for failure. Because if we expect the things that we, do you know what I mean, that we have from before, and not allow them to transform, and not allow them to bloom, and not allow them to grow, then we haven't actually gotten what we should have out of something like a journey like cancer. And that allows for it to not have this huge impact on our daily lives moving forward. It allows us to recognize the trauma that's being happened and ingrained in our cellular structure, and allow us to actually move forward. And this can happen. This is one of the things that I talk to patients about. This can happen at any point. Yes, it can happen after you've been, diagnosed in remission, but it can also happen while you're in active treatment. There are more and more people and clients that I'm meeting that are, they're living with cancer, and they're going to be, right? This is something where it's not going anywhere, right? As long as we can keep it stable, the treatments are working, they plan on being here for a long time. And I think that they should, but that doesn't mean that they shouldn't process this trauma. And so part of the challenge becomes, because of that wording and the fear that's driven within our conventional world and the way we treat it, we have to target in on different types of people. And so I do a lot of clarity around the fact that, yes, it's cancer remission, but you can be in a remissive based state and still be treating cancer like it's an active treatment process, and understand that it can become chronic, in the sense that, it doesn't have to be this I'm in or I'm out kind of situation, and then dealing with the emotional and the survivorship modes that you get put into. Because we all know, one of my biggest pet peeves is people like, oh, it's just from stress, right? I'm not sleeping because it's just from stress. well, we can't all eat, pray, love to get rid of stress, right? Like if we all had the money and we could get rid of all of our responsibilities and just travel the world for the year and sit at a yoga retreat, absolutely, we would freaking be able to go there. But that is not the reality for 99% of us, financially, physically, and some of us, that's not a desire, but it's not enough sometimes to be able to unravel it just by doing some of this mental health work. And it's important to do it, but you have to understand that there's a physiological process that we have to unravel too. And our adrenal glands overthink, right? Like they take over and the brain is like not in this state. It started happening to me around the pandemic, probably when it first started. And I would be lying down on a Friday night and I'd be like, why is my resting heart rate 105? That's never been the case in my entire life. Like as a person who has been athletically inclined, my resting heart rate is 55. And I'm literally lying in my bed reading a book. Why am I at 105 and feel like my heart is racing out of my chest and I'm running away from a lion? And then I started to unravel the fact that my adrenal glands were not able to, they were in that survivorship state. And they weren't able, it didn't matter how many adrenals I took. It didn't matter, like nothing was calming that down. I had to educate the system and get that system to be able to, like my brain to be in charge. And that's something that we do a lot in cancer, right? Because it's like, what's the next scan say? And did the treatment work? And, we're sitting on the edge of our seat. In the book, I talk a lot about how getting even just the diagnosis, people go in that fight, flight, or freeze state and they just stay there. Right. And they don't realize that until they can kill the next thing or whatever it is that it gets them there. And that's one of the reasons why I wrote the book. I have a really sad story about what came to be because a girlfriend of mine was trying to convince her mom to come see me. She was 10 years post breast cancer, had been doing the AI treatments, which is the aromatase inhibitor treatments. And she was postmenopausal and she didn't want to come see me because she didn't have the money. She didn't want to put it in, all that kind of stuff. And probably about 5 days before Christmas, just before her 10-year, checkup, she ended up committing suicide.
Yikes.
And she was dealing with depression that I truly think was multifaceted, right? That survivorship mode, the AI, like all of these different things were contributing to it. And nobody knew, and except my friend. And she kept saying, you got to go see Katrina. We can unravel it. And my girlfriend knew that I was writing a book. And I was trying to work on it. And she came to me after the funeral and said, Katrina, if I had just had your book, I could have given her for $20, right? And she could have gone through it. Maybe there would have been a lifeline, like, do you know what I mean? And maybe because that $20 is not a huge investment, but the steps are all there for her to figure out if they are relevant to her. And maybe there was a connection that she was missing or a piece that she could explore on her own. And so that was really there were many motivating factors, but that was the motivating factor to like make the time and sit down and put it in words and connect the pieces. And that was really moving for me because it was like, this is very important, right? Like it's, and because there are lots of people who don't have the money to come see, but the book is actually built so that you can follow along the steps, that you can actually do the work yourself if it speaks to you. And that's helpful, I think, in practice for an ND too, right? Because they have some broken down ways that they can, decipher a crap ton of information that we get brought in, right? Like one of the things that's a big challenge for us is that we can be, as a naturopathic doctor, we can be a jack of all trades and sometimes we can be a master of none, right? Because of that. And even if we have a focus in our practice, right? Because a lot of people say, oh, niche in, and do you know what I mean? Even then, there's always the case that doesn't quite work the way we think it should, or there's always the case that has some sort of, extra thing that you have to deal with. And there's such a mental, emotional, physiological component that it brings in that, having some way of organizing that information and the patient having ways of being able to see on scales that are free and easy for them to use with good questions allows them to see their progress and to also be able to see what is relevant to them and what isn't relevant to them.
Yeah, I mean, honestly, I hadn't even really given much thought to the post-cancer journey until you spoke, is so incredible. My daughter was there and said the same thing. It's even just having that awareness as a naturopathic doctor. Now, I don't treat adults, and thank God I don't have children in my practice with cancer, but just knowing that you have that resource as a naturopath to say, hey, here's a starting place, right? Or here's someone that you can talk to. And I think as you're speaking, it's interesting because I think about this journey that I've had, like as a parent with children who do have different needs. And so like with my son with autism, I think a lot of parents go through that adrenal fight or flight. And I know, Julie Buckley, who you've met, who's my mentor, who's a pediatrician, you spoke during our amazing cancer intensive. She ended up with cancer after years of looking after her patients on the front lines of clinical care and then helping to recover her daughter, Danny. So it's, stress is, you're the expert, but stress is not a good place to be stuck in. And ironically, Krista, just before we got on, she said, you tell Christina what you said.
I was like, because Jody and I are doing a women's series like once a week, and we just like, we wanted to get it done. Sonia booked it for us, and I'm like, I hate the time.
I made them do it.
I know, and I was like, it's 6 weeks, and it's the fall, and it's like, it's so busy, and I'm like, Anyway, I'm doing it because anytime I say women's health, Sonia's like, it's so boring. And I'm like, fine, you do your peds, I'm gonna do women's health. So I sent Jody a PowerPoint presentation with 115 slides last night. And I was like, I did the adrenal one. And she's like, it's liver and adrenal and it's an hour. What are we gonna do with 115 slides? Like, what's wrong with you? And what about the liver one? I'm like, oh no, I have a 40-point slide on that, just a summary. And she's like, okay. And I'm like, no, we need it. Nobody is doing adrenals. Like nobody is taking over. The school thinks it's crap. The new naturopaths don't even learn it. It's our bread and butter. It's what we see. It's I was late and Sonia was like, we have to, you're going to be late. And so I was like, yeah, but I just had adrenal fatigue cases all day long. And it's what we do. It's how we power our patients up. And so anyway, I agree. And I think it should be mainstream, like main focus. There's tons of research. Like, it's what we do.
And I think there's a psychological component that we forget about, right? Because for the last 10 to 20 years, we've just blamed it on it. It's just stress. Yeah. Right? Yeah. Just get your stress under control. And I was like, not everyone gets to, quit their job, right? Like not everyone can just, right? Like, and the problem becomes, I think a lot of times is to fix it, we find that we have to put more stuff in. Right? Well, what the frick? We can barely deal with what we're dealing with at this point. Yeah. I mean, I had at one point I work in a clinic, and it's always been multiple NDs working together. And I had an ND that flamed out, and they were like, they came to me and they were like, I think I'm in burnout. I was like, yeah, I could have told you that like 6-8 months ago. Like you are filling in more gaps. You're trying to you have to do the other work. And so then it was interesting because she goes, that burnout's a real condition. I was like, yes, you diagnose this on a regular basis. You tell patients that they have burnout. What do you mean it's a real thing? Like, no. It's a real thing, right? Like, we're not just making this shit up, So, it was one of those moments where I was like, oh, so you're one of those that has to experience it for yourself in order to be able to realize that it is a real thing, right? Like you go along and then all of a sudden it happens to you and go, oh shit, this is real. I'm like, oh, yes, it is, So it's definitely a challenging piece because we live in the 21st century and we are constantly bombarded by all of the stuff, right? Like, dealing with it and finding the right support and putting the right places in and learning how to ask for freaking help, right? Like, especially as women, because our profession is a very large women based profession. And then on top of that, all the nuances of like, the landlord wants the next thing and right? And like, what do you mean there's no money left for me and I can't, do you know what I mean? Like, how do we rely on finding the things that we're good at, doing those to the best of our ability, but still finding people we can trust to do the other shit, right? That we just don't, And one of the things that happens for me is that I'm pretty lucky because I did my undergraduate in mathematics. So numbers are not a problem for me. Which, as a science person and a medical professional, that's not always the case, right? Mm-hmm. And so when I'm looking at spreadsheets and information and stuff like that, sometimes, accounting drives me crazy because it's like all weird and everything. It's not just normal numbers. It seems to be made up or whatever, right?
Totally agree.
But the reality is, if I can just have some time and be clear, I'm like, oh, boom, 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 boom. Like I can get there, but I can always, I'm learning now, especially almost 15 years in practice, that if I can't do it, it's not because my brain can't do it. It's because I have too much on my plate. My brain is very capable of doing it, and it really quickly and rapidly, and I can pick these pieces up, but I can't do the other pieces if I'm too bogged down. The first thing that goes for me is creativity. So one of the other things that I will tell you from a professional perspective, get freaking help. I did not seem to do well in practice and deal with my own emotional stuff until I started going to therapy. And it doesn't have to be like, talk therapy. There are so many, ways of moving through this, but you need to have more than your friends, more than your spouse. You have to have a person that's invested in listening to you and that is able to help you make those connections so you can grow. It was pretty interesting because my parents are old school. They're in their 70s. And my dad's experience with therapy was not good previously. And so when I started going, because my parents are around me a lot, and my mom, of course, is like, I don't ever need help because that's the woman that she is, right? Like, no, I'm fine. And I'm like, you're in freaking denial, lady, right? Like, and so interestingly enough, I decided that one of the ways to help them was to share my journey. So as stuff started clicking together and perspective started clicking and I started growing, I would pick and choose pieces and start to share it with my mom. And interestingly enough, she started growing too.
Oh, wow.
To the point where, we've had a lot of grief happen in our family. We've had a lot of loss. My mom's sister became a widow during COVID. She lives really close. And so my mom, do you know what I mean? And my mom's a bit passive aggressive. And so then comments are like taken in the wrong context and we can't deal with it. And do you know what I mean? And so I was helping my mom navigate through that process of how to be there for my aunt, but not cross those boundaries, right? And it was interesting because my aunt, who has a psychological background, and now that she's a little bit further into it, was like, it's so different. Your mom's behavior was so different. And I said, absolutely, because I've been working through the growth pieces with her. And if she won't go and get it herself, at least she is open enough and experiencing it with me so that she's getting to those places where, right, she's actually growing, even though she's in her 70s and believes it's all bunk, right? So it was one of those things where, when I have new grads come in, I'm like, I don't care where you find the money. You find the money, you find the time, you make it a priority, even if it's once a month. I truly believe that people in the healthcare profession should 100% all have a good, connected and person who can listen, whether they have skills, whether they're, do you know what I mean, like whether it's Reiki therapy because it's something that they connect with, whether it's like whatever it is, you 100% have to, because if you're not healing yourself, you are not open to being able to be the vessel for other people. And I think it started because I really didn't want to work in cancer. I was so afraid of it because I didn't want to lose patients. Right? Because that's what happens sometimes. And if you read the beginning part of my book, it talks about how I actually ran away from it because I was like, no, it's not happening. And the universe smacked me in the face because my very first client in private practice ended up getting diagnosed and ended up dying on the table from surgery. And he came to me before the surgery and was like, I'm really nervous. And I said, it's going to be fine. It's going to work out, and when you're done, I'll refer you to somebody else. To be able to take this on because this is not something that I do. And he said, I don't want somebody else. I want you. And I was like, I don't have, I'm not that person. And then when he passed, I spent the time with his wife, as she was going through the grieving process and everything, because she was also a patient. And she said, you know why he said that? Because he didn't trust anybody else. And I went, okay, I get it, universe. Stop giving people around me cancer. I will figure this shit out, right? I will make this work, right? And so
give me a minute. Just give me a minute. And
I'll figure it out. And I did. And I started. And so because of that, I went, okay, the thing that you're actually afraid of is the grieving process and the loss process. There has to be a way where you can sort that out for yourself so that you can be there for other people. And I have an entire, I do. I mean, it sucks because I lose people. right? But I have an entire process that I go through when someone does pass in my clinic. And I truly believe, like one of my mom's friends, she's a psychologist. She has a PhD. She does all this work in psychology. She's like the head of the department at, Brock University or whatever. And she just happened to have a conversation with me. And she's like, must be really hard. What do you do? And I went, well, I do this, I do that, I do this, I do that. And she's like, you got it down pat. Like theologically, you have it down pat. I will not live in a house without a dog, because the dog and I spend time when I lose a patient, because it's that connection to the soul piece for me. And I realized that it's a challenging way. It was a thing because we lost our dog during the pandemic, and he had been with me for 12 years. And I was like, okay, too much responsibility, can't manage it. And at the time, my uncle was going through terminal cancer. And I literally turned to my husband at, 2 months after the dog died and said, we got to get a dog. And he's like, why? And I was like, I don't know. There's something. And then 3 weeks later, right? So we get a puppy and we go through the whole process. And 3 weeks later, my uncle dies. And I went, that's why.
Oh, wow.
Because I need that faith, right? It's only one piece of that, but it's definitely a very important piece, because there's something about that animal for me, and they are freaking attached. I do not understand it. They're attached to everybody in our house. But when I'm going through a grief process, I'm like, why are you like, get away, like, don't be on top of me, right? But they know that they are like, this is a lady, I got to follow her around. They could just, they can just tell. And we've been really lucky because we've always managed to get animals that are trainable. Do you know what I mean? But I think that now that we've had a few, I recognize it's because of the environment that we live in, and the thing that we like, the way that they get emotionally connect. Like, they are slaves to their emotional states, right? Like, they know where they're safe and where they're okay, and they bring that piece down, and all of that stuff, right? So it was a very interesting piece. So lesson learned: freaking get therapy in whatever form and shape you need it, because you can't do this profession without it. You will burn out. You will not do great. You will, right? It can eat you alive if you're not careful. Right. And you can't, it can drain your creativity, which is something that I find we all have. Otherwise, we wouldn't have been brought to this profession. It can legitimately, you could start missing connections, right? Where you would have, do you know what I mean? And just feel like you aren't there. You can, those moments of brilliance where people are like, aha, I think I know what's happening, right? Like, you're just missing out if you don't do it. And you can do it in any way, shape, or form. Like, some people are like, yeah, twice a year I check in. Great. Like, whatever it is that fills your boat, but you need to have that way of discharge and that way of learning and growing, because our practices are so emotional. We hear all the details, right? And we should.
Well, we can't do a case without it, really.
No.
Like, unless you're peds. I guess peds, you have a different, you do, but still, like, you manage your patients through the mom and dad. So you do more emotional work, Sonia, than I do, because you have to take the case, which is pretty clean, and then get the parents to do it, which is like years, takes you years to talk. Like, the trust and the grieving that the parents have. Like, you do more emotional stuff than I do.
I don't know. I think we all do. I think Christina's right. Like, we are all giving out so much, and our art and practice of naturopathic medicine is not just a flow chart to a diagnosis. It's like everything you have and everything you know. And once people do trust you, you are everything to them, because they can't find that in very many, if any, places. So it's, and I think that's the neat thing about having these opportunities to sit down with other naturopaths. And something you said, Christina, when we were first sort of getting on, I think is so important to touch on as a self-care piece, is that, like, you don't have to know everything, right? And I would say, from us, we've started saying no more often than we would have before, because we need to create boundaries, and we need to create like a way that we can get through the day and still go home and be the mothers that we want to be, and the partners we want to be, and the members of our community, right? Because we all are wearing so many hats. But
yeah, I think that's something that it becomes with age and experience. Sometimes if you set down boundaries too early, do you know what I mean? You miss opportunity, but then also at the same time, do you know what I mean? It is this growing piece. You did 99% of us got into this profession for a reason. We had an experience, we were connected, like, do you know what I mean? And most of us go through pieces where we find out what we don't like, right? Like we start out, we hang our shingle, you know what I mean? Like it wasn't, and then we end up going, oh, this is a thing, and oh, I'm good at that, and oh, I like, you know what I mean? And so there's a space, and it's one of the things that I love about our profession. There is space for all of us to practice. There is space, you know, like there are people who are very functional medicine oriented and they just do the labs and they connect, but there are people who love that and they get attracted to that. And if and that's important because I don't want to talk about the emotional spaces of blah 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 and all that stuff, but you still are holding space for them because you're making connections. And if you think you're not emotionally connecting, then you've missed the boat because you absolutely are, because you're giving them information and power and you're taking a different view of it. And, you know, just all the way down to the people who just, you know, they like, and I don't want to say just, but they do constitutional based homeopathy, right? Where they're like literally in that world where they're asking all the questions, they're getting all, there is always a place for all of us. And one of the things that I talk about a lot is the difference between evidence-based practice and evidence-informed practice. I talk a lot about the fact that we have this huge history, and if we could just respect each other and have conversation and have discussion and, you know, treat each other very humanely, we would actually come out on top, right? Moderation is the key, and not moderation of what you do, but moderation of these emotional components and the striping and the, like, do you know what I mean? And respecting the fact that you're allowed to have your own opinion. I don't know where the world became where we had to just get people around us that only believe the same thing as us. Like, I don't remember that as a kid. Like in the 80s and 90s, we would have my uncle over and he was crazy as a crazy person, you know, do you know what I mean? But it was still a part of the family. We would all laugh. We would know which conversations we should do, what we shouldn't do, and do you know what I mean? And we would get perspective from that. But now we've gotten into this world where it's polarization, and if you don't get on my train, you can't be on my train. And like what happened? Where did we get there?
I'm not sure.
You know, right?
Like, I think it's the profound insecurity that a lot of us have had. And I think our profession itself can struggle with this because we're not legitimized in the way we should be. We feel marginalized, but this insecurity, one of the ways to combat it is to say, I know everything. And these people in my world, my circle, also know everything. And the pressure that puts on those folks, it honestly, we've talked about this, it makes me very concerned about their mental health and well-being. I worry about their patients not benefiting from, you know, like castor oil packs or things like apple cider vinegar or homeopathy or
Arnica,
you know, Dr. Chris Bajornal talked about having your heart and soul as a conversation, and you're talking about making sure you're there to support the mental emotional piece. Like being a naturopath is so many different things. I hope we didn't lose you during this conversation.
No, I'm still here. It's just
okay.
my camera decided to be a pain in the ass.
So
you're like,
that's because I was like, I want to keep talking. So I like, I did the phosphorus thing and shut your camera down.
It's all good. But no, I think it contributes. I think sometimes society contributes to this, right? And conventional medicine does this a lot, right? Because I do not want to take away from the fact that they're smart, that they can be well trained. Do you know what I mean? But because of that, there's an ego where they make decisions. So they are never allowed to say, I don't know. Right. And one of the things that I say is, you know, people ask me because I mean, my journey, I was accepted to the School of Medicine in Ottawa, as well as the Naturopathic College. I went to Naturopathic College and I put off my acceptance to the University of Ottawa just to discover, do you know what I mean? And do what because I was freaking 24 and I just had an undergraduate degree. What the hell did I know? Right. So I had done that. And within 48 hours, I knew I was in the right place at CCNM. And the reason was, and people say to me, why did you choose that? Like life would have been easier. And I was like, sure, I would have made more money, but life wouldn't have been easier because I would have been in a box. Creativity would have been stifled, right? And I think the thing is that I went to a place where I was never taught there's nothing more I can do. Do I think I can cure every single person? No, I'm not an idiot. There are so many factors out there that have nothing to do with me, right? But what I can do is I can make life a little bit better, right? I can help a person navigate and problem solve and figure out what works for them and manage and, right, and get them to a place where they're empowered in what's happening. And so I literally say to people, I went to naturopathic college because I was never taught to say there's nothing more I can do.
I love that.
Right?
Never.
I was never.
We're in early practice, and I guess CCNM, right? Grey's Anatomy was on. I mean, it's still on because it's been on for 800 years. But so when I first
True, and I don't know how.
I know.
I first
looks the same. Like, how is that even possible?
So when I first had my kids, they would say, "Oh, you're going to work, and then what do you do at work?" I'm like, "Oh, I save lives." Like, it's funny because he's a neurosurgeon, and I was being ironic, but it's interesting because my son co-ops at the clinic, and to our earlier point with school, it's just been a lovely experience for him to be in a place where he's really valued and very, he's done a great job helping the clinic improve with some of the tech stuff that we're not so good at anyway. So he said to me, he's like, when I was little and you said you saved lives, I thought you were joking. And he's like, oh, I'm gonna cry again. And he's like, now that I work here, I realize that's what you do. So
yeah, absolutely.
We're glad you chose CCNM, and so are all your patients and your students, which I want to talk about because I actually didn't before how, and it doesn't surprise me at all, but how much time you spend thinking about supporting and spending time with students.
Yeah, I feel like sometimes when we get into institutions, especially places like school, learning from the outside world can be hard. Because one of the things that I discovered as I was graduating and going through the process of everything was like, we are very insular. Right? When you're in the college, and I could see this happening because there was a lot of transition. I mean, when I was in CCNM, like, we became part of the RHPA, right? And then we became like, my class was one of those classes that was just always on the freaking cutting edge. But that's my life, essentially, right? Like, I remember a time when we didn't have instant messenger, and I remember a time when everyone else had the internet, and I remember a time when we didn't email our friends, and do you know what I mean? Like, I remember when we didn't have freaking social media, and so this became, and I was always on that age cusp where things were like starting to develop. It was no different at CCNM because I was in that transitional class where they were like, oh, we're going to do OSCEs, right? You guys are the first class to do it. Oh, we're doing NPLEX so that it's case-based. You guys are the first place to do it. Like, and so there was this constant evolution of us closing out the old and opening the new. And what helped understand it was like, I was, my life was going along and I was getting engaged and all these other things. And I was starting to pull out, and I realized, like, I'm standing in line at graduation, and, where all the C's and the D's are and everything. And everyone around me is like, I don't know what to do. What do you mean I'm going to graduate? I can't treat people. And I was like, we can spend an entire year treating people. What are you talking about? Yes, you do. And so literally I turned to my girlfriend and I said, you have to kill somebody. That's the most important part. The rest of it is practice, right? Like, there's a reason they call it practice. You're not having an expectation. And if you have an expectation that you're going to fix a person on the first try, that's an unreasonable expectation, right? What you need to do is be able to understand and take the knowledge and information that you do get, and like, what are all the different types of diet? Like, it's this whole process of like, how do I think? Because that's what it is, right? And these are sometimes the things that we don't always, and one of the benefits of being in a clinical setting with different practitioners, right, that you're practicing under, is you see how different people think, if you're smart enough to be able to go, oh, this is do you know what I mean? And one of the challenges for me in fourth year was like, I was ready and I was done being underneath somebody else. I was ready to like, this is how I want to do life. Like, I don't want to be like, okay, I'm on this shift, so I can't recommend castor oil packs, or do you know what I mean? Like, I really wanted to, like, I was ready to spread my wings, right? And I knew that at the time, and this is one of the reasons why I do preceptors. And I've been lucky. I've had a wide range of students. Like, I used to take fourth year midwifery students. So one of the things in midwifery is that they have what they call an interprofessional placement for a month when they're in fourth year. And so I had a connection with Ryerson University, and I had a couple of these students. And so, like, every 2 years for the first 8 years of my practice or so, I had midwifery students that I was teaching essentially. essentially. And anyone who said, oh, I want to go to a naturopath, the lady at the Ryerson University was like, I got somebody, head out out in Bowmanville, she'll teach you all the things you need to know. I don't do that as much now just because I'm also doing cancer. Like it's more become my focus a little bit. But I always take fourth years, I always take preceptors. And there's this whole piece. It comes naturally a little bit to me because I was a coach originally, right? So I've done lots of that and transitioning it. My first job in university was actually a teaching assistant. So I was teaching first years in second year calculus. So I was the one answering all the questions. And I was like, I do not think I should be the person telling you how to do your homework, but they like me and I can teach it. But the challenging piece to that was that, and this is some of the things that I'm lucky that it comes naturally to me, is like math is one of those subjects, for example, where there are 7 different ways to think about it. And if the person is only taught one way, right, then and it doesn't work for them, then all of a sudden they're getting it all wrong. So you have to learn how to change it so that it works in their brain, essentially, because there's always different ways to look at it. So really good math teachers are the ones that are able to do that. And I think that in our profession is something that I love to be a part of, because it is a process of thinking about different things. And one of the things in my clinic is that once a month we actually have case studies where I'm like, bring your tough case. We meet for almost 2 hours. We bring case studies. We talk about what's going on in the clinic. We problem solve together. And I will say in 15-minute consults, yes, you have 3 brains or 4 brains working on your case, because if something doesn't work the way we think it is, we have a group that we can sit down and discuss it and figure out what else is missing. And that is something that I think it is a tough thing. I know that the provincial associations and different associations have attempted to set up some mentoring type things and figure it out, but it's tough because it has to be fluid, it has to be flexible, it has to keep moving forward. And do you know what I mean? And we get into sometimes we can get into that egocentric where we're like, I don't want to ask for help, I want to know all the things. Do you know what I mean? And so therefore I don't want people to know what I don't know. And so then there's this piece, right? And one of the things that I do with preceptors is I try and schedule them on days where I actually have some breaks. That doesn't freaking happen very often in my calendar, but for the sole purpose of asking them questions. One of the things that happens is that I learn how much they, like where they are at, what they're thinking, where they think they should be, do you know what I mean? And what they're learning. I mean, I've had some very interesting conversations, like where they're like, oh, I don't want to set up I don't want to go in a clinic that already has a naturopath. And I'm like, why not? That is the dumbest thing I've ever heard. 100% you want to be in an office with another ND, right? And they're like, well, we can't do the same thing. And I was like, oh, yes, we can. And we freaking better. Like, this is not a good idea. And sometimes I'm a little bit too honest, right? I'm like, that's not a good idea. Definitely you need to be in an office with another ND. And part of the reason is because there are enough clients out there for all of us. Right? There is enough health that is there. This is not bottom of the barrel competition, trying to just beat the next person. Like, we should all be working in these environments where we can, work together. And, and it was something that I struggled with at the beginning because I'm very far east. I'm very far east. I'm east of the GTA, right? And it's an underserviced, one of the largest growing communities in Ontario, in terms of like, because we're still close enough that you can commute. Right. Yeah. And up until a couple of years ago, people could actually freaking afford to live here. And so, right, it's becoming less of that. I don't know how people afford houses around here anymore, but, but in all fairness, we're still growing. Right. And so when I look at it and I think to myself, one of the reasons that I struggled was because for the first 5 years of practice, I think I worked 52 weeks of the year. I never, like when we started filling those things in for Kono, and it was like, how many weeks off? And I'd go through my calendar. I was like, and 0. And 0. And people are like, well, you should just say, I was like, sure. You tell the cancer patient that you're doing IVs for that are working. I'm just going to take a week off. I have nowhere to send you. Do you know what I mean? I have no idea how you're going to get your treatment. This is not a me versus you thing. And there are people who are able to set those boundaries. I just wasn't one of those people. So when I started looking at a clinic, I was like, this is something that we can do together. This is something where when Katrina takes a week off, somebody else doesn't need to. And when they take a week off, Katrina can be there. Like, it is a co-op based space that we can live in. And whether you work in the same clinic or a similar town, like one of the NDs who eventually left my office was like, oh, I want to work in fertility. And I said, okay, then you need to figure out, like when she left, I said, you need to figure out what you're going to do when they get their IVF and you're going skiing for 2 weeks. Where are you referring them? right? Because that is not something that you have control over. And if you want to work in that profession, right, and in that niche, and you want to work, you need to make sure you have the capacity to do that, right? And it's fine, right? But don't tell me you're going to specialize in, or want to specialize, I can't use that term, but don't tell me you want to niche in fertility and then go, oh, well, I don't do any acupuncture. I'm like, what? Like, you have to have a referral partner, because that's the only way that this works, right? Because you have to know that is something, you know. One preceptor came in and said, oh, I want to work in cancer. I said, okay, great. When are you getting your IV license? And they're like, oh, I'm not going to. And I was like,
I love it. Yeah, I love this.
What?
Every student needs to hear this. You need to get your IV license if you can. You're prescribing, like, you need to listen to Dr. Cox. Yeah.
Like I was like, then you're not working in cancer. like you realize, like, I was like, either you work in a clinic that does it, or you find a referral. Like, this is not impossible if that's not something, but you need to make sure you have those relationships, because you're not helping a patient.
Yeah.
When the research shows that these are the things that we do that other people don't do, and that they are that ingrained, how can you say that is something that you want to specialize in if that's not part of your thing? So yes, if that's a boundary and you want to do it, you have to know that this is a whole thing. So either you make the relationships, you have the referral partners, you find somebody else that does that part, but don't be silly, right? Like, use common sense, use that piece to it, right? Like, I'm not saying you have to be everything to everyone. No. But you absolutely have to know that if this is something you want to do, that the research is there. So you either have to figure out what your referral partner is, so that they are getting the full care. Because honestly, if it isn't patient forward, is it really any different than what they already get?
Yeah.
Exactly. I mean, I think if you want to do the best for your patients, then that has to be more important than ego. That has to be more important than competition. That has to be more important than anything. And I think those naturopaths like yourself become at the head of their, field. Like, they are just patient centric, and it is, you can tell it makes a difference in patient care and patient outcomes and what you do
I've
for
been
the
in the
community.
same place for 15 years, and I have patients that will go, right? They move, they're good, life is good, and they come back.
Yeah.
I've been doing this for almost 15 years now, and I still go, oh, I've been seeing you in 10 years. What's going on? And they end up back. Like, there are still a ton of other naturopaths that they could go see. And some of them have even gone and seen other people. And then they come back and they go, oh, wait, right? So that is the important piece, because they know exactly who an expert is for them, or they know exactly what you become a trusted resource, essentially, right? And if it is a boundary for you, I'm not saying there isn't some sort of solution out there, but freaking figure out the solution first. Don't just walk around going, yeah, I do this, but I'm not doing the full patient-centric thing, right? Figure it out. Like, there are lots of, and I don't know what they are. I know what they are for me, but I don't know what they are for you. But there are lots of flexibilities and lots of solutions. And what we have to, like, I literally tell my girls ask me all the time, what do you do, Mom? I'm like freaking Carmen Sandiego. Like, I am literally problem solving all of the time, right? Like, it's like figuring out the solution that works for this person, and that's, and using the research, the data, the experience, all of that stuff to be like, oh, I have a brilliant moment. There's a light bulb. Let's try it. We got nothing to lose, right? Oh, that's something that's not going to hurt this person. Let's try it, right? And so those are the moments that we all have, and I truly believe as a profession, we all have them. If we can just sometimes get out of our own way and listen and connect those pieces, have that confidence. You're not wrong, Sonia, when you said, self-doubt and self-confidence is a big key factor. And that's one of the reasons why therapy was so important for me as my self-care, because I definitely struggled with that. It was very different than a lot of other people, but it's still, I still have these moments, right? But definitely it's different when you start working through it and growing, and then being able to, put your feet down and feel grounded in what you're doing.
But you opened up your practice to your patients to give you feedback, which means that's a lot. And that's your choice as a practitioner. You didn't have a framework. You didn't like, you're doing this, then you're doing this, then you're doing this. You're like, we're doing this. How do you feel? And that is great. I mean, that's what naturopaths mostly do. We ask our patients to give us feedback. They give us feedback. They're involved in the process.
Yeah, absolutely.
no other profession is like, we're gonna take a line and then change based on what you feel, because that's the give and take. That's the process. This is,
Yeah,
it's a lot.
empowerment. It's an empowerment process,
Yeah.
right? In my 15-minute consults, I say to patients, you are an expert in you. You tell me what's happening, right? I want to know what's happening at 3 a.m. and how you're feeling and all that stuff, because all I bring to the table is some medical knowledge and some experience. That's what I bring. We are now a partner. If you are, like I even tell them, this is one of the other pieces that I do. I do a lot of the weird and abnormal shit, right? When people are like, oh, I've seen 3 NDs and it didn't work. And I'm like, yeah, okay, let's break it down. What can I learn from the experience of all these other people? Do you know what I mean? So that I can, and I'll even say to them, they were not necessarily wrong, but they weren't able to partner with you to go through the whole process, right? Because they weren't able to listen, they weren't able to get there, they weren't able to be more creative, weren't able to find the next solution. Do you know what I mean, right? And all of that. And I'm lucky because I'm coming in at the end and I'm seeing what didn't work, and then I'm able to go, oh, well, if that didn't work, let's do this and that connection, and right, we're going this way. And so we have one of those like value statements, right? It's up on the wall in our clinic, right? Right? And it's empowering people to something, and the word empower is the first word, right? And I was like, yeah, that is it, right? So yeah,
it's a lot. We appreciate you so much. We do think about you a lot. I know we're like on opposite ends of the GTA, but we know
We're super far west. No,
yeah. we do know that you're doing good work, and
amazing work.
Thank you.
Absolutely amazing work.
yeah, so just know
Thank you.
we're thinking about you, and we hope you're the best. So we'll let you go. I know your little ones are waiting for you, but anything you want to leave with, anything you want to make sure that
Well, I just want to make sure
okay.
yeah.
I was like, you cut her off.
No, I didn't mean that. I was like, make sure you
yeah.
get this book, make sure you share it with anyone,
yeah.
patients, loved ones, friends, like, yes.
I think my parting piece is two pieces of information. One, evidence-informed practice is the key. It's not evidence-based, because unless your patient was actually a study contestant, right, in the study, you have to take that knowledge and apply it, right? What the study gives us is information about what went wrong, what went right, right, and what we can apply it to. So evidence-based practice is a misnomer. I call bullshit on that. And number two is, right? And number two is, honestly, you can do everything, right? If you want to write a book, if you want to formulate, we are drawn to this profession for a reason. What you have to understand is that we all need experience, right? Unless you're going right into admin work and you want to, run at the college level, even then, I still think that those people should be out in private practice for many, many years before getting to understand what they need, in order to be able to figure out how to teach people. But you need that level of connection, touch points, right, to be able to do that. But it's possible. It is absolutely possible. If you ask my grade 12 English teacher if I would have been an author, an international best-selling author, she would have laughed her freaking ass off. Right? It was the lowest grade. It brought down my grade point average, but boasted me out of a bigger scholarship, all that stuff. She gave me a pity A minus. Right? And she told me it was a pity A minus.
Look at
right?
now.
But now, you're right. I went, everything is key, right? I do have stories that I can tell. There is a way that I can write this, and do you know what I mean? And I loved it, and I would do it again. So limitations are other people's limitations do not have an impact on you, and get your experience in clinical practice in order to be able to do the next thing that you want to do.
I think you should write a book called The Opportunity in Naturopathic Medicine, because that was amazing. I love so many of the points that you made. That's amazing.
We'll just let AI
AI, yeah, that's true. You can tell on the video.
Little secret that I'll share is I loved it so much that I think my next profession will be being an author.
Amazing.
Wow.
Yeah.
Awesome.
I haven't I got to figure out how to freaking work less in the clinic, because I see a crap ton of patients, and I'm working on what that looks like, so that people are, because patient centric, I got to figure out, make sure that I find the right key elements to be able to take care of the people in my community, and the people that come to me, and that's really key. But I'm in my early 40s. I got lots of lifetime left,
Yeah.
you know, right? And I definitely, I mean, I loved it so much that I would absolutely do it again, in many, many ways. Yeah.
I love it.
I look forward to that.
I love
That's
it. I hate writing. So I was like,
you have a book due right now for NFH. You've got a book due in like 2
I
weeks.
was like, love it. Hard. Don't love it. Don't love it.
So I think the key though is like, if you have to figure out what your strategy is, right? Because
Yeah.
I did a lot of dictation.
Oh,
I did a lot of dictation for it. I did, and I had, so I did have an editor that was
Yeah.
like, you know, a legitimate editor, but I also had an ND friend of mine who is phenomenal at editing. She, Dr. Quinn Hand, is excellent, and she has got this graph of helping me transform, keeping the ND stuff right. Because there were definitely times when I'm like, I felt stupid. I was like, oh my God, this is not right. And she, you know, right. I'm like, please don't go to press. That's wrong. Right? And she's like, chill out. Absolutely. I caught it. We edited it. Like, do you know what I mean? Right. And so it's about finding those people, because that process was actually fun, because I felt like I could get caught, right? Because there's just so much data, information. Do you know what I mean? And so there is a way to do it where it can be fun and you can use your information and expertise. But I think it's about finding the group, because it's what I discovered is authoring is not a single piece. All you need is one seed, right? The seed of what you want to say. And then as long as you can organize it and figure out how to put it out there, right? You know, in terms of like those thought processes and those key features, the rest is the team. That's the sunshine, it's the air, it's the, do you know what I mean? It's the water, it's the soil, that's all the rest of it, right? And I think that it's no different in our profession, right? We, you know, it's the seed of what you know, and then it's the rest of it starts to come together. I think the true thing in humanity that we have, it different from a lot of other things on this planet, is the fact that if we could just live in that world where we plant a seed and really, you know, find the right ways and environment, that we would be much better off.
Yeah.
Right. You know, because it's not about surrounding us with people that are singular in mind frame. It's about surrounding us so that we have that good base foundation, you know, right? All the pieces are coming together.
So we can thrive.
We can thrive.
Absolutely. So Carissa, I know you're brilliant. I know you can freaking put words on a paper, and don't let the thought process of what it's supposed to be get in the way of actually sharing you.
Okay.
I'll be your soil.
Okay.
There you go.
Thank you.
You're welcome. I swear to God, like, send a
you.
draft, find a person, keep finding it. Like, I sent it to a lot of people before I was able to like actually get to that place.
Okay.
And you know, because I just went through my connections and went, who do I feel could be there, right? You know?
Yeah.
And there were definitely some people who were able to give me different pieces. Right. And so it is, you know, I know that it feels daunting because it's just this everything is on paper and people can read it. And one of the things is people will pick it apart, but you didn't write it for the people who hate it.
Yeah.
There are going to be people who pick it up and go, this is crap. I didn't write it for you. I don't care if you don't like it.
Yeah.
Right. Because I didn't write it for you. I wrote it for the person who goes, aha, aha, aha. Right. Like, you know, and that is the piece. Okay.
Right.
You can do it.
I got to go home.
I know you can. All right.
Oh, thank you. This was amazing. Big
Thank
hugs
you.
and all the best. And I hope everyone watches this more than once.
Yes.
All right. I'll see you later.
Okay,
Bye, guys.
Thank you. Bye.